With the permission of the chair of the program, Honorable Chief Guest, Dr. Khurshid Alam, Directorate General Health Services of Government of People Republic of Bangladesh, may I invite you to please kindly share your thoughts with us.
That palliative care could be implemented in any part of the disasters of human life. But for me, as a surgeon, I have to face so many malignant patients and I have to operate on so many patients. And later on, when I meet them, what I found that they are not curable, or the patient came to me at the end stage of their life for surgery, they want to be cured. But the exact word I cannot relate, I cannot communicate with them that you are not going to survive, you have to accept it. But all of us know that every soul shall have the taste of death. Kullu nafsin za'iqatul maut. Palliative care, to me, is not an hospital-based program. It could be a part, but community should be involved in it. Otherwise, we can't provide, we can't involve, we can give mass people to this service. And it requires physical, psychological, social, and spiritual support, as far as I can understand. So we are to involve the leaders, or public leaders, then religious leaders, then the representatives of the local community, and other healthcare provider peoples. You know, the healthcare system of the Bangladesh has got a very extensive, what I should say, it is a very elaborative and deeply rooted structure extending up to the union level. That means the last fraction of a community or the district. So, if we can use this structure to provide the palliative care, I think we will be able to include all the peoples who really require it. A patient underwent abdominal perineal resection and having a colostomy. And he's we just discharged the patient from the hospital. None is there to advise him how to run the rest of the life with this stoma. And the patients sometimes come to us and ask, should I go to the prayer? Can I enter into the mosque? Can I go to the pond for bathing? Can I go to the public place? Can I have so and so? What would be my sexual life? These are a lot of questions. All of you, the doctors who are associated with this, all of you know these problems, but there is none to address these things. And in the last or end stage of the patient treatment, we always say that, okay, this will not be cured. Okay, just you go to the home, have the foods and drinks you want to have, and that's all. But I think through palliative care philosophy, we could provide the peoples a dignified life for the uh, rest of the period until they die. We all know that malignancy will kill the patient or other disaster will kill the patient. A four-limb amputated patient might survive for a long time from road traffic accident, but he must be rehabilitated. He must be encouraged to lead a life with a dignity. And for that reason, I think the non-addressed part of this medical science in our country should be addressed in such a way so that the mass of the peoples could get the flavor of it. And what to do, how to start it, and how to run it, and how to disseminate it. And most of the peoples, even in our medical background, they don't know what is palliative care and what is to be done. So if we start from the knowledge, that means the curriculum, education, and other things, this part should be included. Number one, it should be included also in the primary education. That means at least from the high school or secondary schools, some information should be there that this can be done. And the young peoples should be motivated for this sorts of service, and they must be included, and they are to be encouraged to come voluntarily to provide the service. And from the government side, I can say that the structure which is persisting, we can use these structures to provide the palliative care. It is not like that you are to implement, you are to recruit new peoples, you have to spend a lot of money and a lot of things, but you need motivation, dedicated mans, dedicated human beings to encourage the mass people to, what should I say, অন্তরে প্রদীপ জ্বালানো. That means you have to need light in the soul of human being to help the distressed people who are going to die. This should be started right now. Government has got plan to build 8 big hospitals in 8 division of the country. These are comprising, one discipline is cancer, that means treatment of the malignancy. Then another is the cardiac disease, and another is the for the kidney patient, that means relating with the nephrology. I think as because this project is still in the preparation phase, we could approach to the government to allocate some places or some scopes to provide this palliative service in this part. Training only the central hospitals, healthcare providers will not solve the problem, as because they are only in the service providers of the Dhaka city, but most of the peoples who are residing in the different parts of the countries, at least in the first step, we could target the 8 division, so that we have got 8 medical institution, big medical institution, and near about 2 to 3,000 patients are treated every day in those hospitals. So we can involve those hospitals and structures and the manpowers, and we can also involve the healthcare providers in the field, especially the health assistants, family welfare visitors, and other providers. And there are big number of people in the family planning wing of the health ministry. We can also involve them to give this service, or to disseminate this program, or to disseminate this idea among the peoples. The schools, colleges, and the general institutes should be informed about this discipline and the plan, and how should we proceed. Now, a few days ago, there was a meeting in the Prime Minister office. I was there. The meeting was public-private partnership, and in different ministry, they provided different projects regarding this. But I'm sorry to say that there is no important projects from my ministry uh, was there. So I think this could be also a good subject, which we can place it to the Prime Minister office, and we can talk with uh, the policymakers and other peoples, so that we can implement it. And from my side, I feel as a surgeon, the patients who are suffering from the malignancy, this they feel the, what should I say, worst feelings of their life, especially after surgery, when they get the chemotherapy or radiotherapy, and the side effects of these treatments makes them crippled. The patients are vomiting, and at that time, none remains with them, only the family members. And by this time, you know the socioeconomic condition of the Bangladesh, And by this time, family members are also exhausted by spending money behind their beloved ones. And the shock of negligence from the beloved ones, I think, is the worst things in human life. If I found that my sons are not caring for me, informations and the spreading of the informations and involving the mass peoples in the palliative care should be our prime aim and main objectives, and we should start it immediately, though it is a small, but we should start it. We have to start it in the urban areas, in the rural areas. Right now we should start from the patients who are suffering the diseases which are not curable, but to improve their quality of the life and to dignify their life, we should start it right now. And I don't know how far I can help you, but I'm sure that I'll try my level best to remain with you and to work with you, holding your hands together so that we are not lost. And I hope that some works could be done if we have got a good desire and we are sincere in it. I would like to request all of you, those who are involved in this program, should come forward, try to remain together. But we have to remember that one point that only establishment of an unit is not enough, and we are to nourish it continuously. We have to take care the program continuously. I will take the informations from you later on to continue discussion and chalk out a preliminary plan how the government could be incorporated into this program and discuss with me. And I am here, and I'm promising that I will try my level best to help you. Thank you. Thank you so much. Stay safe and stay blessed. Thank you all.